Are you familiar with the subtle warning signs of a heart attack that only appear after age 65? What if I told you that the most dangerous heart attack symptoms in seniors are often dismissed as normal aging? Did you know that recognizing these unique warning signs could mean the difference between life and death, often within minutes? Welcome to Gray Wisdom, where we uncover the truths about aging that others won't tell you. For those of us over 65, heart attacks don't always present the way medical textbooks describe. In fact, nearly 40% of seniors experience entirely different warning signs than younger adults, signs that are frequently overlooked even by medical professionals. This information isn't just important, it could save your life or the life of someone you love. Before we dive in, make sure you subscribe to Gray Wisdom for more senior health secrets delivered every day. When it comes to heart health, our bodies at 65, 70, or 80 speak a different language than they did in our younger years. The aging heart undergoes significant changes. Our blood vessels become less flexible, our heart muscle thickens, and our nervous system responds differently to pain and stress. These changes mean that the classic heart attack symptoms many of us learned about, crushing chest pain radiating down the left arm, often don't apply to us anymore. Instead, our bodies signal distress in more subtle, easily dismissed ways. Think about Martha, one of our viewers who shared her story with us. At 72, she experienced unusual fatigue for 3 days before her heart attack. No chest pain, just a bone-deep tiredness she attributed to getting older. It wasn't until her concerned daughter took her to the emergency room that doctors discovered she was actively having a heart attack. Martha's story isn't unique, it's alarmingly common. That's why today, we're focusing on the 5 deadliest heart attack warning signs unique to seniors. Signs that many doctors won't tell you about, but that could save your life. Warning sign 1. Unusual fatigue and weakness. The first and perhaps most overlooked warning sign is unusual fatigue and weakness. This isn't your typical end-of-day tiredness or the normal fatigue after physical activity. This is different, a profound, unexplained exhaustion that seems to come from nowhere. You might find yourself unable to complete routine activities like making the bed or taking a short walk to the mailbox. Tasks that never winded you before suddenly leave you needing to sit down or catch your breath. What makes this warning sign particularly dangerous is how easy it is to attribute to normal aging or to dismiss as just having a bad day. Many seniors experience this fatigue for days or even weeks before a major cardiac event. Margaret from Florida told us, "I thought I was just tired from helping with my grandchildren. For about a week, I could barely keep my eyes open past dinner. Then one morning, I couldn't even lift my arms to wash my hair. My husband recognized something was seriously wrong and called 911. The doctors later told me I had experienced a heart attack and likely had been having one for days." If you notice a dramatic change in your energy levels, especially if it comes on suddenly or persists, don't wait. This could be your heart crying out for help. Warning sign 2. Shortness of breath without exertion. The second warning sign might seem obvious, but it has a distinct presentation in seniors that makes it easy to miss. Shortness of breath that occurs without physical exertion is a critical red flag. Many of us expect to be more winded climbing stairs or walking uphill as we age. But becoming short of breath while sitting in your recliner, lying in bed, or during a quiet conversation is not normal aging. It's your body telling you something is seriously wrong. This breathlessness occurs because when your heart isn't pumping efficiently, fluid can back up into your lungs. The challenge is that this symptom often develops gradually, making it easy to adapt to without realizing the danger. Harold, a 78-year-old retired teacher, shared that he started propping himself up with extra pillows at night because he felt he couldn't breathe properly when lying flat. "I just thought it was age or maybe allergies," he said. "I had no idea my heart was struggling until I mentioned it during a routine checkup 3 weeks later. My doctor sent me straight to the hospital." What's particularly important to understand is that this shortness of breath often occurs without any chest discomfort whatsoever. In seniors, especially women over 75, it may be the only symptom of a heart attack. Warning sign. 3. Subtle digestive disturbances. Our third warning sign is perhaps the most commonly misinterpreted. Subtle digestive disturbances that mimic indigestion or stomach upset. As we age, many of us become accustomed to occasional digestive issues. We might blame spicy food, new medications, or changing dietary habits. But digestive symptoms like nausea, a feeling of fullness or pressure in the upper abdomen, or mild indigestion that doesn't respond to antacids can actually signal a heart problem. These symptoms are particularly common in women over 65 and men over 70. The reason? The nerves that supply the heart and the digestive system are closely connected. And as we age, our bodies sometimes have difficulty distinguishing where pain or discomfort is originating. Elizabeth, 83, told us she spent 3 days taking antacids for what she thought was heartburn. "It wasn't severe, just an uncomfortable pressure right here," she said, pointing to her upper abdomen. "When my arm started feeling weak too, my neighbor insisted on calling 911. The paramedic told me later that what I was calling heartburn was actually angina. My heart muscle wasn't getting enough oxygen." What makes this warning sign particularly dangerous is that it's easy to self-treat with over-the-counter remedies, potentially delaying life-saving care. If digestive symptoms are unusual for you, don't respond to your usual remedies, or are accompanied by any other symptoms we're discussing today, it's time to seek medical attention immediately. Warning, sign 4. Unusual mental status changes. The fourth warning sign is rarely discussed but critically important. Unusual mental status changes that can precede or accompany a heart attack in seniors. When the heart isn't pumping effectively, blood flow to all organs, including the brain, can be compromised. This reduced blood flow can manifest as sudden confusion, disorientation, or uncharacteristic behavior that family members might mistake for dementia symptoms or medication side effects. Robert's daughter noticed her 76-year-old father, normally sharp and articulate, suddenly couldn't remember his address during their daily phone call. He also kept losing his train of thought, which wasn't like him at all, she recalled. "I thought maybe he forgot to take his blood pressure medication, but when I arrived at his house, I found him gray and sweating." The emergency room doctor later confirmed he'd had a minor heart attack that morning. This symptom is particularly dangerous because the affected person often can't recognize it in themselves. They may seem irritable, withdrawn, or unusually sleepy. Some may even resist going to the hospital because they don't recognize the seriousness of what's happening. If you notice a sudden change in mental status in yourself or a loved one, especially if it's accompanied by any other symptoms we're discussing, don't wait to see if it passes. This requires immediate medical evaluation. Warning, sign 5. Jaw, neck, back, or upper body discomfort. Our fifth and final warning sign is perhaps the most insidious. Pain or discomfort in areas other than the chest, specifically the jaw, neck, back, or shoulders. In younger adults, heart attack pain typically centers in the chest. But as we age, our nervous system processes pain differently, and heart attack symptoms often manifest in these other areas instead. This is especially true for women over 65, who are more likely than men to experience a heart attack without any chest pain at all. The discomfort might feel like an ache, pressure, tightness, or even a burning sensation. It often comes and goes, which can further confuse matters. You might feel it in your lower jaw, radiating up toward your ear. Or perhaps it presents as a dull ache between your shoulder blades that you assume is from gardening or an old injury flaring up. Jeanne, a 69-year-old retired nurse, ignored a persistent ache in her jaw for nearly 2 days. Even with my medical training, I didn't connect it to my heart, she admitted. I kept thinking it was dental, maybe an infection or grinding my teeth at night. When the discomfort spread to my shoulder, I finally realized what was happening and called for help. What makes this sign particularly dangerous is that these pains are easily attributed to arthritis, muscle strain, or other common issues in seniors. If you experience unusual or unexplained discomfort in these areas, especially if it's new, comes and goes, or is accompanied by any other symptoms we've discussed, seek medical attention right away. Now that we've covered these 5 critical warning signs, let's talk about why recognizing them quickly is so important. Cardiologists often refer to the golden hour, the first 60 minutes after heart attack symptoms begin. Getting treatment during this window can dramatically increase survival rates and reduce heart damage. Unfortunately, because seniors often experience these atypical symptoms, the average delay in seeking treatment jumps to over 4 hours for those over 65. Every 30 minutes that passes without treatment means more heart muscle is dying. This is why understanding these unique warning signs isn't just helpful information. It's potentially life-saving knowledge. Dr. Eleanor Simmons, a geriatric cardiologist we interviewed for this video, put it plainly. In my 30 years of practice, I've seen countless seniors who didn't recognize their heart attack symptoms because they were waiting for the dramatic chest clutching they've seen on television. The reality is much more subtle, especially after age 70. If you recognize any of these warning signs in yourself or a loved one, here's exactly what to do. 1. Call 911 immediately. Don't drive yourself to the hospital, and don't have someone else drive you unless absolutely necessary. Ambulance personnel can begin life-saving treatment the moment they arrive. 2. While waiting for help, chew an aspirin, unless you're allergic or have been told by your doctor not to take aspirin. This can help reduce clotting and minimize heart damage. 3. Try to remain in a seated or semi-reclined position to reduce strain on your heart. 4. Make a list of your medications if you're able, or have someone gather them to show the paramedics. 5. Unlock your door if you're alone, so emergency personnel can enter if you become unconscious. Remember, it's always better to seek help and discover it wasn't a heart attack than to ignore symptoms and suffer permanent heart damage or worse. Today, we've explored the 5 deadliest heart attack warning signs unique to seniors. Unusual fatigue and weakness, shortness of breath without exertion, subtle digestive disturbances, mental status changes, and pain in the jaw, neck, back, or shoulders. These warning signs are different from the classic symptoms most of us learned about years ago. They're often subtle, easily dismissed, and frequently attributed to normal aging. But recognizing them could save your life or the life of someone you love. Remember that seniors, especially those over 70, often experience heart attacks differently than younger adults. Don't wait for crushing chest pain to seek help. Any of the symptoms we've discussed today warrant immediate medical attention. especially if they're new, unusual, or persistent. Talk to your doctor about your personal heart attack risk factors at your next appointment, and consider sharing this information with friends and family members. Knowledge truly is power when minutes matter. If you found this information valuable, please hit the like button and share this video with a friend who needs to hear this. Your support helps our community grow. Thank you for joining us today at Gray Wisdom. See you in the next video.